Good morning, everyone. Nurse Paul here. Just want to do a quick TikTok video on medication errors and a warning to med techs or certified medication aides. Okay. What I want to talk about is and what prompted this is I was scrolling through my Facebook page this morning and was actually getting ready to leave and ran across this story. And these incidents take place about 40 times a year in the United States. All right. An investigation is underway into the death of a 10-month-old baby after a Kentucky doctor reportedly left her granddaughter in a hot car for roughly 8 hours. The name of the child, I'll skip, was found dead on August 13th. About a week ago, inside a vehicle parked outside of Owensboro Health Multi-Care in Madisonville, police said, according to WFIE, the local station. The doctor had picked up her 10-month-old granddaughter that morning and was supposed to drop her off at daycare before heading to work, police said. Instead, the doctor drove directly to work around 8 a.m., clocked in for her shift, and forgot that Scotty was still inside the vehicle. And this is a medical doctor and that works for a hospital and, of course, has devoted her whole life to increasing the well-being of others. And unfortunately, this happens instead. So, I want to discuss what this has to do with the passing of medications, and just because through my independent research, I've concluded and think I can make a case, and I've already written one article on this, and hopefully we'll have the opportunity to do a lot of papers on this during my master's program that I'll be starting October 22nd. And in that program there will be a lot of APA papers I'll have to write. And so hopefully I'll be able to write a lot of papers on my research on this during that program. Through my personal research, I believe that medication errors, medical medication errors, and that would be excluding people who have a medication error in their home, who self-medicate. In facilities and hospitals, I've come to believe through my research that medication errors are the number one killer in this country annually. Forget heart disease, forget cancer, which are the two that have held the number 1 and 2 spot, heart disease being first, cancer second. I think in the very least, if medication errors don't kill more people annually than those two things, I believe medication errors are at the very least in competition for spots 1 and 2. Okay? So, this is a serious medical issue, and ironically, during a time when the Ohio Board of Nursing is partaking in endeavors to dumb down training for medication aids, which is, of course, completely insane. So, I think I mentioned about an average of 37 to 40 children die yearly because they are unintentionally forgotten in hot cars. Now, what I'm going to take a few minutes to talk about is why this happens, how it applies to passing medications, and how it can be prevented. Why does it happen? Well, first of all, know that the whole idea of multitasking is an absurd fallacy. Okay? The brain is not wired to multitask. All right? The brain is primarily wired to do one task at a time, all right? And it's called focus, all right? So the brain is primarily wired to do one task at a time, all right? So researchers say that these accidents happen due to a powerful conflict in the brain memory systems, where the brain's autopilot, or habit memory, all right, overrides conscious intention, or what they call perspective memory, all right? And this is the instance of this, or the possibility of a accident happening, of course, is compounded by stress or lack of sleep. And as we know, nurses don't experience any of that. All right. So we are creatures of habit, and probably the most being unfamiliar with residents in long-term care. And by the way, long-term care is where we're going to have the likelihood of these errors, because in long-term care they don't have the preventative systems that hospitals have. All right? In long-term care, you're not scanning a wristband and then scanning the little bubble pack that the medication comes on, and then scanning something on the EMR. Okay? In long-term care, they don't have any of those kind of systems. It's strictly the It's strictly the 6 rights of communication administration, right? Right dose, right patient, right time, right drug, right documentation, right route. I think I got them all right? So, why does it happen? Well, in the case of people leaving their children and forgetting them in the back of cars, okay? And by the way, on all new vehicles, I've had 2 new trucks in the past couple of years, and in both cases, whenever both of my trucks, I don't have an extended cab, but I have one of those, they got a couple jumper seats in the back, and behind the front seat there's places you can store stuff, and if you've have to transport somebody, there's 2 little jumper seats back there. Well, whenever I open that mini door that's behind the front doors, whenever I open that, all right, and shut it, and then go to a destination and turn off my truck, there's this alarm that says check back seat, and the icon is actually a little baby in a baby seat. Okay? So, that is to the extent that it's happening where car manufacturers are now implementing that feature. So how does it happen? This happens due to a powerful conflict in brain memory systems where the brain's autopilot or habit memory overrides conscious intention or prospective memory, often during a routine change, and then maybe throw in some stress and extreme tiredness. Rear-facing car seats and a quiet sleeping child can also remove visual and auditory cues. All right, and remember, in passing medication, the 6 rights are visual and auditory cues, right? So instead of the bells and whistles of what the new truck does when you've opened that back door and put something back there, instead we have the 6 rights. All right. Now, when we're training medication aids, oh my goodness, it seems so redundant. When you open the MAR, you do the 6 rights. When you take the medicine out, you do the 6 rights. You do the 6 rights bedside. And then when you put the medication back, you do the 6 rights. And I know what a lot of students are thinking. Oh boy, I'm not doing all of this when I'm working the floor. There's not time, right? I would greatly encourage you to dump or discard that mentality. All right, and I'll get to more of that in a little bit later. So what happens is, and I thought they had a. So what happened is that, and I thought I had this printed out, but I didn't. But what happens is like in the case of this doctor, you've got the daily routine of going to work. All right. So the daily routine, and this doctor is in the habit of doing this, right? Memory habit. All right. And while being unfamiliar with residents is a danger and likelihood for error, what can be equally as dangerous is when you're familiar with your residents and you're doing that same haul every day, and passing those medications becomes automatic, right? And on some med passes, some of these nurses are so incredibly fast at doing these med passes, and why? I've watched them. They'll do the whole pass just from memory and then go back and sign everything off. All right? So basically, due to auto memory and the mind's autopilot, that can be just as dangerous as not being familiar with the residents. Actually, not being familiar with the residents, you're going to be more focused on each administration. And probably the reality of the matter is, due to this, how the mind works, actually being unfamiliar with the residents is probably safer. Okay? So, basically, the doctor's got this routine, and then the daughter calls. Hey, something's come up. On your way to work, can you drop off the granddaughter? All right? So grandma goes and picks up the granddaughter, puts her in the back seat, and on this particular day, the baby's baby bag and everything is in the back seat, out of sight, out of mind. The baby is perhaps facing the rear of the car. I don't know what the laws are on that. But on this particular morning, the baby's not making any noise and maybe even falls asleep. And it's back there not making any noise. So as the doctor is going towards the same direction as the daycare and the hospital, her mind becomes dominated by what's going to be happening during that day, which for a doctor would be probably pretty intense, right? So, out of habit, the doctor just, no dummy, it's a medical doctor, and probably has her act together and her life together pretty good, right? And so, out of habit, and being focused on what she's got ahead of her that day, that's how it happens. She drives past the daycare center, goes to the hospital, gets out of her car, clocks in, and completely forgets the baby is in the back seat. All right? It could happen to any of us. Because this is how the mind works. All right? So how do we apply that to med passes? When you're passing meds, you can't exclude those cues that we're talking about. All right? So, in prevention of this thing happening, if you read some of the preventions that they're now talking about, the baby bag goes in the back seat. Things like the baby bag goes in the front seat. Okay, rather. In this case, how great would it have been if the doctor had taken her tags, her hospital ID, and put it with the baby in the back seat, right? Okay? She's not going anywhere in that hospital without the tag and the scanner code. And the barcode that's on the tag. She's doing very little without that. Put that back with the baby. So, in the same way, we're talking about going through the 6 rights and having a procedure that prevents med errors. Okay? So, 1, know that the brain is not wired to multitask. And I'm going to give you some clues here as a medication aid, all right, to prevent med errors, all right. 1 patient, 1 administration, one patient, one administration. Okay? First, so let me number these. It looks like we're going to have 5. Know that multitasking is a fallacy. It's a lie. Brain is not made to multitask. I know in a lot of, especially in administrative, higher administrative positions, multitasking is looked at as a talent that proves you're smart. It's all a lie. Brain's not made to do it. Okay, so forget that. That's 1. 2, one patient, one administration. Okay? Only have the screen up that is the patient that you are working on that at that time. All right? And the example that I always use when I'm teaching medication aids is you're at a med cart, all right? You're at a med cart, and we're going to talk about parking the med cart at a certain place and walking the medications to the rooms. All right, we're going to talk about that. But for now, the example is you're putting together a medication for Molly down at the end of the hallway, room 22. All right, you're putting Molly's meds together. And an aide or hospice or the DON comes up to your cart and you get into a long discussion about Betty. All right? So now Betty is getting on up into your brain and things about Betty. Okay? And so you finish that conversation. While you're doing that, you're pulling Molly's meds. And so as you're walking to the end of the hallway, as you're walking towards the end of the hallway, you pass the dining room, and guess who's in the dining room eating? Betty. And you say, what in your mind? Oh, there's Betty. And you walk into the dining room, and you give her Molly's meds. Happens all the time. All right? So, when you have that screen up and you're doing administration, I'll tell you what I do. If somebody comes up, starting another conversation about another resident or other things, I just stop. Okay? I just stop pulling those meds. I just stop. Okay? And carry on the conversation, take down my notes, and in some cases, if I haven't unpackaged anything, I'll just stop, put the meds back, and just start all over on that admin. Okay? So, only have up on the screen. And I mean, what's the worst if you're in a conversation about Betty and you're in the middle of pulling Molly's meds? What's worse is if there's questions about Betty and now you've got Betty up on the screen instead of Molly. Don't do it. Only have the person that you are passing. Okay? Never pull meds for a resident if they're not the ones up on the screen. That's the second thing. Okay? All right? So, one patient, one admin. That's 2. 1. Know that multitasking is a fallacy. 2. One patient, one admin. 3. Number 3. Respect the 6 rights. Respect the 6 rights. Respect the 6 rights. Okay? That's your cue. That's hanging your name tags around the baby's neck in the back seat. Okay? That's putting the baby bag in the front seat where you can't miss it. Okay? 4. All right? 4. There's actually 6. Okay? My mistake. There's 6 of these. And that's cool, because there are also 6 rights. So these are the 6 preventative measures for the 6 rights. Okay? So respect the 6 rights. That's 3. All right? 4. And I already stated 5. I got ahead of myself. So we already stated 5. And that is 1 patient, 1 administration. Only have the screen information up there that during that administration. Okay? So 4, I noticed in a facility where I'm working, all the RNs do this. Okay? Or at least the 2 night shift that I've worked with from time to time. I noticed both of those RNs who are passing meds at night are really big on rolling that cart up to the room. Okay? And I've started doing that, by the way. All right? And that's just an important cue. And especially in memory care, where the residents like to mess with your cart, it also makes it good. All right? You can keep an eye on everything while you're in the room. All right? I have made it my policy as a nurse to roll that cart up to the room. All right? And you know what? I'm going to add a 7 for medication aids. I'm going to add 7. Okay. So, roll the cart up to the room. Okay. And that's 4. We already did 5. You only want that resident up on the screen. Okay. 6. Make the procedure the habit. Not shortcuts to getting meds passed to 30-some residents in some cases. Okay? Make the procedure the habit, not your shortcuts. That's disaster. Okay? Making your shortcuts the procedure is the baby in the backseat. Okay? Make the 6 rights your habit. Make whatever quirky safety procedures that you've come up with yourself, because no one knows better than you how your mind works. Make that the habit. Okay? But again, see how I'm flipping this. You gotta make the safety procedures, you've gotta make that your habit, rather than habits that you've picked up from other nurses or whatever facilitates getting the med pass done in an efficient manner. Okay? Those things may be good or bad, but you don't want to make those your habit. Make things like the 6 rights your habit. Okay? Because then it's automatic and it's just as fast anyway. I'm going to add a 7th. And then we're going to close out. Okay? Leave your stinking cell phone in your nurse bag. Okay? Oh my goodness. Fellow medication aides. Please tell me that you're not going to be distracted by your phone while you're passing meds. Oh, please. Just don't do it. All right? Anything that you need on the internet for looking up drugs or other things, you know, your EMR has access to the internet. You just open up another page and do your research. Do you know, as a nurse, I don't take my phone into the facility. All right? Sometimes the DON will get upset with me and said, "Hey, didn't you get my text? I've been trying to get a hold of you." Good luck. My phone's in the car. All right? As a nurse, I do not take my phone into the facility. And every now and then I work as an aide. And even then I leave my freaking phone out in the car. Okay? What bigger distraction on the face of the earth is there than cell phones? Not only that, studies prove that 90% of our cell phone use in the United States of America is leisure. What are we doing partaking in leisure while we're on the floor caring for patients and residents? Why? Okay? It's just silly. Don't do it. Now, you don't have to be as extreme as me, but at least leave your cell phone in your nurse bag behind the nurse station, all right? Please don't tell me that while you're doing a med pass, you've got your cell phone sitting on the med cart texting your buddies while you're passing meds. You're not doing that, right? Okay? So, that's everything. I hope this is helpful. All right? And, when I feel like saying something, these TikTok videos are kind of quick and convenient. Hope you enjoyed it, and see you next time.